used to. Our parents didn't talk about mental health, so it's
Yeah.
awkward for us. It's not a model behavior for us, so we are trying to step into one shoes that we have never like witnessed. We don't have
Yeah.
any lived experience. So
Hmm.
we're just being a cycle breaker here, and we're just having these conversations, and a good way to start is.
Awesome. Thank you so much, Vidya, for joining me on this podcast. This is the first of many series, and I hope we see you here. I know we spoke a lot before this, and I just kind of love to just kind of hear your story, like your background, what brought you into this field. Because I think for a lot of us, like at least me, right, like I really like sometimes wonder, like when I speak to my therapist, like what made you want to like get into this field where you're listening to stories day in and day out, and like what's the motivation behind that?
So just to give you a little bit of background, I grew up in a big joint family in Kerala, India. It was about, I think, on an average 30 people in the household, all kind of age groups. So imagine growing up in that kind of an environment with that, the whole like coconut yard, and
Yeah.
it was beautiful at the same time. It was just like overwhelming with that many people. So I grew up listening to all these stories from everybody. Doesn't matter any age group, gender, or like even race for that matter, because we were not very like the place that I'm from. You see all kinds of people from northern part of the country, and then sometimes we had relatives who were married to foreigners, so called.
Right.
So we got to experience all of this because I was in the middle of this house where everyone just kind of gathered. So yeah, I got used to listening to stories from all around the world, to be honest. So, and that's how I wanted. I kind of thought that I was a good listener, and I love listening to stories.
So, like coming back to your background and experience, I know we connected on like mental health and what it means these days to like, especially the South Asian culture, right? There's still a lot of taboo, there's still a lot of stigma, but at the same time, there are some amazing conversations happening in the field. And I, as a layperson myself, who has been in therapy, I always get this question from people like, what made you go to therapy? Like you have friends, you have family, why go to therapy? And I've always been like stuck, like I have my own reasons, right? Like it's like I didn't want to come across as being weak or being vulnerable, or I didn't want to show you like there's this other side of me. And a therapist just seemed, to me at least, like this is a safe space, a non judgmental space. But I know, like speaking to you, when we chatted a few days ago, you really went deep into like the differences of a therapist versus a friend versus a life coach. And I think it would be so helpful to just hear that from you again, right? On what are the differences and like sort of how do they like complement each other? So if there's someone out there who's thinking about seeking help for whatever struggle they're going through, it might really help put things in like perspective for them.
Yeah, yeah, and I really appreciate that question, Nisha. So, there is a place for everyone in the universe. That's kind of how I go about life. Life coach, therapist, a friend, a confidant. It could be anybody. So, a friend is someone who you can always rely on. They understand your journey, and they also come with this preconceived notion about your beliefs, your life, and also they kind of already have um, a I guess, conceived notion of what they're supposed to say.
Mhm.
So they're kind of playing the tape according to what you sometimes should hear, or sometimes a friend already has this prejudice towards you, going, "Oh, I've already advised this multiple times to you. Now you're
Yeah.
going back there, the same hole again, rabbit hole again. I don't want you to go back there." So all these dynamics play into talking to a friend.
Yeah.
Again, nothing like it, but this is the other side. And when it comes to a life coach, again, if you want to have a good vending session, you want to hear somebody just listen to you, have your thoughts and feelings validated. I'm sure a life coach is wonderful because I know someone personally who I've worked with. She's done wonders to me. But again, if this is more of a clinical disorder, if it's a mood disorder, if you're going through clinical depression, anxiety, and there's like a whole gamut of
Yeah.
things that I can come up with. And if you're looking for a diagnosis, so if you're working with an insurance, for an insurance, you actually need a diagnosis, which is based on DSM-5, and
Mhm.
you need a code. And that's just the basic. And then from there, if you want a scientific evidence-based practice or tool to
Mhm.
work
Mhm.
with this particular issue that you may have, that's where a therapist or a licensed counselor comes in. Because for me, to be a therapist who is licensed, it takes at least 8 years
Right.
minimum with the internship, your grad school, undergrad, all of that put together, and a lot of clinical one-on-one experience.
That's
So
right. That's right. I mean, I think I read somewhere, and I don't know if it was you who told me this or if I actually did read it somewhere, like the amount of hours that you need to undergo with like supervision, right? In that, that is also like, I think it's about 1,000 hours or something, right?
it is about 1,000 hours, and you have to bring all your cases to your supervisor. And for most counselors and therapists, the supervisor actually really has does a lot of hand holding,
Yeah.
and you just don't go off and diagnose people.
Right. Yeah. So that's so then that takes me to like my next question, because I know like when I was kind of thinking of, for me it was more like, I'm not sure what's kind of going on with me. And you would speak to your friends like when you're like demotivated or you don't have the energy, and they'd like pep you up and whatnot. But then I also started doing like a lot of my own like reading on, why am I feeling the way that I'm feeling. And I think a lot of times, when people think about like anxiety or depression, they always think that, and I'm guilty of this, that there has to be a reason attached to it. So when you spoke about like a clinical diagnosis, right, clinical depression or like clinical anxiety, what does that mean? Like how does that differ from you just not being in the mood for, let's say, like a couple of days, right? Like you're just kind of like, oh, it's the lunar cycle or like whatever, right?
Yeah.
So how do you how do you know, like, as a regular person who's not gone to a therapist, who's kind of still hesitant to talk to their doctor about it, right? Like, is there like a self diagnosis almost, like where you're like, okay, I'm going to do this quiz or whatever, and it says I'm depressed or anxious, and I think I need to see a therapist? Then, like, is there something like that?
There are, this day and age, everything is available on the internet, and there's so much of self diagnosis.
Yeah.
It's almost, I don't know if it's as helpful as you think it is. Yes, the awareness on mental health is much higher than it used to be, but it also comes with this negative problem because most often Instagram is used as a therapist, right?
Yeah.
Read a couple of things on how to get out of this. God forbid, if it's a really critical case of depression, that's not what you need.
Yeah.
Because just to go back to your question to answer it, self-diagnosis, is it possible? Most of the time, I think when most people go through depression, they know that they are not at their performing best.
Yeah.
Something is wrong. And again, a lot of people look around them and they're like, oh, I'm working, my family love me. What's going on
Yeah.
here? Shouldn't be depressed.
Yeah.
That's kind of what you were talking about, I
Yeah.
think.
Yeah.
When everything is going at its best, why am I
Right.
feeling low? Why is my energy so low? Why do I have like why do I just can't have the purpose in life?
Yeah.
It's that lack of motivation, all of that. So, all of these symptoms are leading to the diagnosis. So, as to mild, medium, or severe, it's based on how long, how critical, what is the genetic history. We have to do a lot of history taking. So, that is where the clinical experience comes in.
Yeah.
It's not based on, oh, so this, maybe you're depressed. No, it's not even in one session.
Right.
It's over 1 or 2 sessions that we take a critical history, the trauma background, because I'm a trauma worker. What has been the trauma, even from the time of conception?
Hmm.
It's not even from the time you are like 5 or 6. It's so when your parents decided to have you, were your Was this a planned pregnancy? We start
Hmm.
from that point.
Oh, wow. I did not know that. That is so interesting. So it's almost like, because I know like a lot of the times, like even when I started therapy, I went for like 2 sessions and I'm like, why am I not feeling better? Like, what's going on here? And then I realized again, it was because there wasn't a place for me to be like vocal about it, right? Like, hey, everybody, like it's very different. Like when you're going for like if you're like diabetes or something, right? Or if you have had a heart attack, like everybody knows about it, right? And they're all rally, they support you, they, give you whatever you need. But I think there is still, I don't know if it's a mindset thing or if there's like that, or maybe it is some kind of like trauma from the experiences we had when we hear about other people who've gone through depression or anxiety, right? That it's like the care that you receive or the reaction that you get is very different from when you say that you've had a heart attack or I've been diagnosed with like diabetes. It's very different. So a lot of the time I just did a lot of like self research into, okay, why isn't it working for me? It's been like 2 sessions or 3 sessions. And then I realized that it is, like you said, a very ongoing journey with like specific things that you have to work on. And like you said, going back to your childhood or um, and I don't know if a lot of people are like aware that that's how therapy works. It's not a one stop solution, right? It's a constant like work in progress.
Yeah, and we talk about this. So my course has been very trauma informed. I think that's the language and that's the lens that we use, rather than looking at where the client is right now. It's not a one-dimensional view. It's more like we call it a genogram, where we draw up like about 3 generations out. Who has been married to who? How many divorces? How many deaths in the family? How many separations? So it is a lot of history taking, and then we understand where the person stands socially, and also culturally, right? Because I work a lot with BIPOC communities here. So you need to understand what are their lens. Do they consider themselves Black? Is that a cultural identity that they relate with? Just
Hmm.
because they may look a certain way doesn't mean they identify with that, right?
Yeah, yeah.
Same with South Asians.
I think this is so useful and helpful because a lot of the times, even when I'm this advocate for therapy, right? They all talk to me about, why don't you just like talk to a friend? Like therapy, it's just talk therapy, right? You're just talking to somebody and they are basically just listening to you and giving you their opinion. But the way you described it in like all the different steps that a therapist makes that client go through, that we may not necessarily understand that that's what you're doing and there's a purpose behind it. I think it's so helpful to know. So what would you say, like if you're have like for somebody, like I'm just going to keep using my example because pretty much I'm the only one that I know who goes for therapy. you know uh
And I
so
have to say, you're so honest and vulnerable, and I appreciate that so much.
yeah,
Not many people are.
so that is one of the things that we're trying to change here. I honestly want to try and see like how many people can start having these conversations very openly, right? The role of a therapist, right? We we keep seeing this trend of um, equipping like managers, equipping parents, equipping friends, or your caregivers, or whoever it is, your tribe or circle, on how to help someone when you know that they're struggling or they're going through something. And I think a lot of the times there is pressure on the person themselves to be to vocalize that feeling that they're struggling. And so as a therapist, like what how do we as caregivers identify those signs of struggle and then advise them on, hey, maybe you need to see a therapist. Because a lot of the times the advice I get is maybe you need to speak to your aunt or like an elder person in the family. And it becomes like a joint kind of a family session almost. And that's like a lot of stress and trauma for the person going through that struggle, because you're not ready to word vomit like whatever you're going through. So how would you how would you set the stage for like advising somebody for that, right? Like if I'm seeing my child struggle or if I'm seeing my husband struggle, how do we do it in a very non awkwardy way, if that's one way of putting it?
So just to go back to like the history of how we got advice, right?
Yeah.
It's probably not the best way how growing up all of us got advice from every uncle and auntie that
Hmm.
the neighborhood or relative, but that's all I think our parents had available at that time, and that's the best they knew
Yep.
that time. So sometimes when you can't get through to your child, you find somebody from the community or a religious person or like an elder uncle or aunt, and you just bring them in for this intervention.
Yep.
Was it effective? Maybe. Is it the best way? Possibly not. But given the resources, I think that's the best they could do at that time. But fast forward to today, where you are right now, Misha, with your kids. If you see these things, so what does I love to use this example of depression with kids because I primarily work with adolescents and
Hmm.
kids,
Hmm.
just so that the audience they know. So, what are some of the signs in adolescence for depression? Are they going to just curl up in a corner and are they going to cry? Most likely not. You will see that they're getting angry. You
Hmm.
see mood swings. You see lack of energy, lack of motivation, things that they used to enjoy. They're trying to pull themselves away, pulling away from social circles, um, and a lot of questioning. You see that they're self doubt and questioning their purpose, and in some of the more severe cases, self harm and suicidal ideation.
Hmm.
Um, but before we get into the severe cases, but these are when I started, those are like that's the first phase where you can try to catch it. And what is the how do you open up the conversation? Is it awkward? It might be awkward because
Yep.
we are not used to. Our parents didn't talk about mental health, so it's awkward
Yep.
for us. This is not a model behavior for us, so we are trying to step into one shoes that we have never like witnessed. We don't have
Yep.
any lived experience, so
Hmm.
we're just being a cycle breaker here, and you're just having these conversations. And a good way to start is, I hope you feel safe enough to talk about this. And I'm going to tell you in the next 5 minutes, I'm not judging you. It could be at the kitchen or while you're cooking, however you want. And that's where you can bring this up and say, what's going on? I just feel like you've been acting a little differently.
That's again such an interesting take, because the mindset that people have, or maybe I'm stereotyping here and generalizing, but just the word therapist, psychologist, clinical psychologist, these are terms that we are not used to. And these still have this element of, oh, you're seeing a therapist. Oh, you're seeing a psychologist. Like it's still there. And even sometimes for me also to say that, like it's easier for me to say therapy because that term has been so much loosely used. It's, been the topic of like jokes, and we joke about things like this. So the word therapy is always like easier for people to use. But when but when you say, I need to see a psychologist, I think again, like the stigma is because of the lack of awareness of what that role is, because you know what a cardiologist does, you know what, like, I don't know, like a gynecologist does. But when it's like a psychologist, I think because people relate it to something that's unseen, and there's always that fear of the unknown, right? So, oh, is it like a head doctor? Is there something wrong with you? Is it affecting your ability to behave like a normal person on a day-to-day basis? How do we change that? Like, I know we talk about it, right? And you spoke about, you put it in such a nice way of what is it that a psychologist does and how they help you and their role in when you're going through a mental health struggle. What else can we do?
I think the what you're doing right now, Nisha, is just like spreading awareness, and you're literally doing your best because you're just one person, but you're spreading awareness so much for just being the spokesperson for each and every one of us. And I thank you for that because it's not easy. And it's again breaking the stereotype, right? You said that you're scared of what you don't see and the unknown and things you can't see. And also, people equate mental health issues with being weak, being
Mm-hmm.
broken, and honestly, I hate this word, but being cuckoo.
Mm-hmm.
It's just there's so much. But if you have a heart condition or you're diabetic, no one calls you these things. No one
Yep.
says that, oh, you're weak. You're weak because you have a kidney failure. No, no one's going to say that.
Yep.
Oh no, I hope you find the best doctor.
Yep.
And what about your brain? I
Yep.
don't understand the stereotype, but I think every day as we exist, just eat, breathe, sleep, we need to make it like our mission to talk about this.
Yep.
And it's not just from a point of view where we're trying to break stereotype, also to just provide that kind of information that help is needed. There are a lot of people who actually need the help and
Yep.
are not getting it because of the stereotype. So more
Exactly.
than me being a therapist and making my career important and myself look important, it's about actually making sure that people get the help they need.
Yep.
Um, and regarding who would need the help, I think everyone needs a therapist, to be honest. I see a therapist, myself,
Yep.
I see my therapist once a week, but that's not practical.
Yep.
There are some serious, I guess, situations in life that I like to start from the beginning, from
Mm.
time of conception through, I guess, 65 plus the senior community. So I can just quickly go through it.
Yeah, of
So,
course.
yeah, why would you need therapy? During conception, if the child was conceived um, during a traumatic situation, or if the mother was going through some kind of emotional disturbance or some other kind of stressor, it's it's been proven that the child is usually prone to mental health issues, which is why from that point onwards, that's where you start therapy.
Hmm.
And I've seen children in the place that I work they have infant mental health counseling. I personally have not been involved in that, but there is a whole community that provides infant mental health services.
So when you say infant, are you like, are they newborns?
They are from um, 6 weeks and up.
Wow.
Yes, and
I
that's
did not know that.
and I used to work in a trauma response team, and mostly they have witnessed the mom has witnessed someone being shot in the family. It's extreme violence, so they
Mm-hmm.
feel like the child in vitro
Mm-hmm.
probably has the same kind of stress. And when they're born with that kind of dysregulated nervous system, they are prone to anxiety and many other issues. So they start therapy at that age. And then starting toddler, which is maybe I see kids from 2 and above, and I see them in a play therapy room. I'm not
Mm-hmm.
sure if everyone knows about it. I'm a play therapist. What that means is you don't just play. The
Mm-hmm.
entire room, I wish I had my play therapy room in the background. It's filled with toys. What it looks like is probably your child's toy room.
Mm-hmm.
So essentially, through play, children process trauma. And to give you an example, there was a child who had witnessed. This is a trigger warning for everybody because I'm a trauma therapist. These are the stories. The child witnessed the mom being stabbed.
Mm-hmm.
The mom passed away, and the child, he is a 3-year-old boy, and in the playroom he just played, but all that he played with was there was a zombie, which was a tiger, that kept attacking the sheep and kept saying that the sheep was dead, and he would find a coffin because we have everything in the playroom
Mm-hmm.
where they can reenact the whole life. Would put the lamb or the sheep in the coffin and would just put the coffin away. Every single day this was the game. And then after a couple of weeks, That stopped. We started exploring other themes in play
Mm,
therapy. So essentially, what happened is this boy, he can't sit across the couch and talk to me. He's a
right.
3 year old. He's not even ready to process them. He can't even verbalize what he saw. He
Yep.
processed his trauma in a safe space with a therapist.
Wow.
He knew he was safe. That's the beauty of play therapy. And that's from 3 to, I would do it through 12 or 14-year olds. Some of the 14-year olds don't want to play with me, so I don't.
Yeah.
Then from 14 to, I guess, early adulthood, it's mostly life transitions. They're figuring out their sexuality, gender identity, just who they are, and they want
Yeah.
to develop their independence, and also they're challenging authority, right? All
Yep.
these things, career, pressure with life, school and
Yeah.
friendship,
I
how
mean,
they
as
look.
parents also, we are also kind of, because we've like, like if your oldest child is like turning 14 or 15 or 16, you're also experiencing that for the first time, like a
Yeah.
first time parent of a 14-year-old or a 15-year-old. And I think there's always that struggle between, am I a friend or a parent? Like, how can I create that safe space for my child? And it's
I
to
tell
just,
all my clients when they walk in, you are
yeah.
not here because you're broken.
Right. And I think that's again the stigma or the blocker that we have, that, oh, if we are considering like a clinical psychologist who is a doctor, right? Based on their experience, degrees, whatever. I think the blocker that we have is we go to a doctor to fix things. So if I'm going to a therapist who is a doctor or a clinical psych or even just a psychologist, like in the medical field,
Right.
there must be something wrong with me. And it's conversations such as these that we go, it's not just, there is nothing wrong with you. We're just setting you up for success to
Yeah,
be.
and it's mostly situations. I always start with the we've been taught this also all through our trauma courses, right? You don't ask what's wrong with you. It's always what happened to you. What happened to you? And that's always how we start. So when you switch that up, you
Mm.
automatically start thinking about the situation around, which is where I'm a clinical social worker.
Yeah.
We don't just treat the brain. We think about what are the conditions around.
Yeah.
So if somebody is sick, rather than treating the person, we go check the water. Is the well poisoned? Because that's what's happening. It's not just one person oriented. It's the whole community, the society, a family, a system oriented approach. Again, these are really evidence based practices
Yeah.
that therapists learn and practice, and we've been supervised. And
Yeah.
that's where a therapist comes in, wherein we're not trying to fix you, we're just trying to give you the tool set and the skill set for you to navigate life.
Yeah. I think if you really want to go like deep, because I feel like if you're talking to a friend or whoever, right? Most of the time, and this has been my experience also, is like we treat, like it's almost like we treat the symptoms. If you're having a stressful relationship with your spouse, what can you do moving forward to mitigate or manage that, right? What are the proactive measures we can take? And then I remember when I went to my therapist, she was like, let's go back to your childhood, let's go back to how you perceived relationships growing up, and how is that affecting the way you are bringing yourself into your relationships. And to me that was like an aha moment almost, right? Because you don't think about all these things. Um, so I think again, like it's just like really going back to understanding the role that a therapist like truly plays in your life. And I keep saying that therapy is like going to the gym, but it doesn't necessarily have to be like a therapist, right? And like you rightfully said, there are situations where a therapist is your best sort of option. But in this journey of bringing out conversations around like mental health and whatever you're going through as a new parent or in a new relationship or at a new job, there are other things that you can use to if therapy is not something that you can afford, or is not practical, or is not a choice or an option for you, there are all of these other outlets, so to speak, right? Like meditation or yoga or a life coach, who I think is amazing, right? Because I have a life coach as well. I have a life coach and a therapist, right? And I see how well they complement each other. In fact, I'm able to bring my best self to my life coaching sessions because of the work I've done with my therapist. Like, I'm
I
able
love
to
it. I love that you
understand
said
it, right? Because you're able to understand things on a deeper level when your life coach gives you like the things to do, and vice versa, right? Like, I'm able to bring my authentic self to my therapy sessions because of the work I've done with my life coach. um, so I think it would really help if you kind of go back and like kind of just reiterate the message of, therapy is, it has different meanings, and different therapies all encapsulating, like it includes your sessions with your friends, your life coach, but professional, like I don't even know what the term is. Like, what is the term, like if you
I
go
think through
beyond a
my
life coach?
experience, through my experience, what I've learned is um, it's not even the race or the degrees that a therapist has, because people always think, oh, a brown therapist, South Asian, I could relate. Sometimes you might be able to relate to a white therapist more than a brown
Yeah.
therapist. Who knows? So it's not all of that. What actually brings value to a therapist, according to me, it's just my personal experiences, experience. You have to be able to work with all kinds of spectrums to be informed. And just coming from a really humble and point of humility, where I
Mhm.
love the word cultural humility. You have to approach with that kind of a humility when you approach clients, and also with a curious mindset where you
Mhm.
want to learn. Don't go in assuming, oh, this is bipolar. Oh, she's totally schizophrenic. Oh, this is narcissist. These
Mhm.
words are so overused.
Yeah.
I check myself when I fall into it. I see eating disorder patients. I
Hmm.
used to work in a clinic with eating disorders, anorexia, bulimia, all of that, binge eating. Again, there's so much prejudice against the community, right? People
Yeah.
come in with, why can't you just eat a burger? It's
Yeah.
not just eating a burger. Or substance abuse or alcoholism. Why can't you just stop? Just stop.
Yeah.
Stop drinking. It's more than that. Or
And
porn
that's when you
addiction
need that.
or gaming, any addiction. It's all a negative coping mechanism. But don't walk in thinking you know it all. So it's just having the attitude and experience that helps a therapist be a good therapist.
Yeah, and I think that's when also you realize that, again, it's about trying to figure out like what is the best option for the client.
I can imagine someone listening to this going, so how do I know who to go to, right?
Yeah.
So say I'm going through a tough patch with my husband. Do I go to a life coach? Do I go to a couples therapist? So the answer to that is a couple of things, right? What is easily accessible to you? Because we have to think from practical point of view. What's
Yeah.
affordable? What can I afford now? Because sometimes therapy can be really expensive. If
Yeah.
that's not something you can do right now, me sitting here and preaching, go to a couples therapist is not going to work. So
Yeah.
then what is the other option? Are there help in the community? Many times within religious institutions and community-based services, they have counselors. So
Yeah.
maybe go to a counselor. So what is easily accessible, and what is the most practical option? Based on that, you need to do research and be an informed client or
Yeah.
patient. There's nothing more than being an informed patient or client.
Yeah.
You have to put in the work yourself,
Yeah. Yeah.
and
I
that's
think
the
that's
best
the
way.
thing. That is what we sometimes like hesitate on, right? Thinking that this person is going to do all the work for me because that's what I would expect from like going to a doctor, right? Like I expect the doctor to tell me do A B C D, but I think when it comes to mental health it's a two-way street. Like you have to do the work, and I did not realize this until I myself went into therapy. Like the work that I have to do outside of therapy to bring my best authentic self to my relationships like around me, it's a lot of work.
And I always tell my clients, you have to show up for yourself.
Yeah.
I am just like a blind monk walking along the mountain with you. And you are the eyes. You are telling me what's happening, and I'm based on what you're telling me, I'm guiding you. Because remember, I'm blind. You
Right.
decide to fall off the cliff, both of us fall. So
Oh my
essentially,
God, that is so awesome.
just because I'm with you, I'm this well informed monk, doesn't mean that I'm gonna stop you from falling off the cliff. Because guess what? It's your eyes and your story. I'm telling you my advice based on what you are seeing. So you choose where you want to go. This is my first speech with all my clients.
Oh,
It's
that is,
copyrighted, by the way. I'm kidding.
dude, but that is so awesome. Like I never thought of it like that. Everything makes sense now. This has been so amazing. I know we're gonna see you back because I think just during this conversation itself, like when you were talking about like kids and trauma, I can already like see you coming back and us like deep diving into a lot of those things. But thank you so much for your time. I loved talking to you. I think we can keep talking for hours if we could. So we'll see you back again soon.
Thank you. And I just want to thank you for the wonderful work you're doing. It's amazing the passion you have, because when I speak, I drink this Kool-Aid. This is what I do. And for someone who just had this experience, like a lived experience where you couldn't find somebody to, I guess, the right fit for you, and
Yeah.
then you took it as a passion to be the change, um, to get everyone the help they need. It's just amazing. Not many people do that. They just have the experience and they're like, guess what? Nothing can be done. But I tremendous applause. Oh my God, this is
Thank
just like
you.
amazing, Misha. You're so inspirational.
Thank you. Thank you so much. I hope like I keep saying that even if like one person or but the goal is not one person. I want more than one person to feel inspired and empowered. And I guess the takeaway really is to let people know that they're not alone. You're not alone. You know, it's really hard to seek help. I went through that. I know that. It's really hard to seek help, but you're not alone. If you extend your finger, there is somebody to literally hold your hand. So I think that is the takeaway from all of this, and like that's the end goal, right? Just to let people know that like they're not alone. If I
Yeah,
can
and
inspire
everyone's
a few.
listening, you're hurting, it'll stop.
Yeah.
It does get icky and sticky, it will get better.
Yeah.